In 1995, the Cashier Family Foundation conducted a survey which displayed that 73% of women and 70% of men believed that men were not responsible enough to choose a birth control method. In our society today, even though that gender equality is being realized, the responsibility, the cost, the side effects of birth control, plus the monitoring of safe sex and possible pregnancies is almost always falling on the women. The responsibility role of pregnancy preventatives must gain a balance between both individuals involved. So, as part of my persuasive speech, what I am persuading is that vasectomies need to be used as a more regular, widely, and common birth control method. And the reason that I argue this is because, according to research and doctors, vasectomy procedure is actually the best and most effective birth control method other than abstaining from sex. And also, only 1 to 2 women out of 1,000 will get pregnant within the first year following the procedure. And there's little to no side effects with the procedure for men. It is a simple and inexpensive procedure that is safe, and it is reversible. So now I'm going to explain a little bit about how the procedure works and what's done during the procedure. So the male has 2 tubes, and they're referred to as vas deferens. And what will happen during the procedure is that they're cut or sealed by the doctor, and this allows the sperm to be blocked from reaching the semen. So it's simple. It's a very simple procedure. It lasts for 20 minutes or less. And as I said before, there's little to no side effects. And for what side effects are most common is swelling and inflammation. And this can be managed, this pain can be managed with pain medications such as ibuprofen, but it's very natural, and it will decrease and disappear with time. So now what I want to talk about is the problem at hand is that birth control is generally a bigger expense for women than it would be for men if they were the ones that were financially responsible. So the Cashier Family Foundation, the same foundation that did the poll in the quote that I stated at the beginning, also found that women spend between 30 to 44% out of pocket for oral contraceptives per month. And this doesn't include anything that has to do with their insurance. It's just completely out of their pocket. And to give you a little bit more perspective on pricing, according to Healthline, women actually spend on average $50 a month for oral contraceptives, and this adds up to being about $600 per year. So when you compare that to what it would look like for when a man's purchasing condoms, for example, you can purchase a condom for between $1 and $20. So $20 compared to $50, this is less than half of the cost for what a woman would spend monthly. And also, there's been reports done by Men's Fitness that the average person has sexual intercourse 103 times a year. So that averages to be between 9 to 10 times a month. So if you compare having 10 condoms costing $10 versus a $50 price tag for an oral contraceptive that women have to spend, 10 to 5, that's just a very unreasonable ratio, and overall it does not equal out, and it's very unreasonable. Furthermore, the other problem that women face in this situation is that even if a woman wanted to get their tubes tied to allow them to not get pregnant, it is an unreversible procedure. That being said, most doctors are very, very reluctant to perform sterilization for young women, but even if they don't want to have kids, because it's not reversible. And it's very hard to find a doctor when you're under the age of 40 to perform this procedure. Compared for a man, it's very easy for them to be allowed to do this procedure, and it's also reversible. So because both parties are responsible they need to be responsible when having sexual intercourse, and it only falling naturally on the women and nothing being said about it, I believe that to be very unreasonable. So now what I'm going to talk about is some birth control options for women and some of the side effects that come along with that. So over the years, birth control has really expanded, and instead of just having oral birth control pills that you take every day, we've been able to come up with different forms, for instance, like patches that women will have in their arm, or they'll have shots or injections every month, or an Nexplanon implant that implants under your arm on either side, or an IUD. The problem though with all of these is that, for one, they come with side effects, but for two, all of the responsibility and all of taking your pill every morning, of going to the doctor and getting your injection, of making sure you put your patch on at the same time every day, it all falls on the woman. And overall, even though that these forms of contraception are very safe and positive, there's a 2 to 9% failure rate when using contraceptives. And as I said, also before, the average cost of just oral contraceptives is $600 per year, while the average cost of condoms per year is only $200. So some cons of birth control for women: all women have side effects, and typically they're pretty negative side effects. They just change a woman's body and the way that they function. So some examples of this could be depression, weight gain, irritability, mood swings, nausea, headaches, vomiting, insomnia, dizziness, fatigue, or really constant bleeding and spotting between periods, and there's many more. As I said before, birth control is overall a safe option, but it can increase health problems for females. Through my research, I found that heart attacks, liver problems, blood clots, and strokes can all be increased in a female's health. And also, through my research, according to American Cancer Society, when you take birth control pills for an increased amount of time, you're at higher risk for developing breast cancer and cervical cancer over time. So that's why doctors are very hesitant and will not prescribe easily birth control and don't recommend it to women over the age of 35. So now that I've gone on all the cons of birth control, the pros overall is that it is 99.9% effective, especially with newer versions of birth control. Although, at what cost? It does provide a safe and reliable form of contraception and pregnancy prevention, although based on all the cons that I said, I wouldn't want to go through that. And I have gone through that, and I know many who have, and it's very difficult. So overall, how I believe this problem can be solved, and a good thing to talk about with your partner and have this conversation, is birth control options for men. So vasectomies they have a 0.15 failure rate, and the average cost for a vasectomy is $86 over a 10-year period. And it only involves 2 procedures. One to enact it, which, as I said before, will take 20 minutes or less, and it's the same with the reversal. And there is a 95% positive rate that it will reverse. And also, there are little to no side effects, and really, ultimately, it's not about just putting the cost on the guy. Having both individuals talk about maybe sharing that $86, splitting that cost, or having one person take care of the procedure and one person buy condoms for the year. So it's about collaborating and actually having that conversation, and still realizing that there is a birth control option for men and that it does not always need to fall on the female. So overall, the benefits of this solution, I believe, will decrease side effects for women, and there will be little to no side effects for men. And this is according to medical research and doctors who have commonly performed this procedure. And as I stated earlier in the presentation, it is the most reliable method of birth control and prevention of pregnancy. And it's an excellent and reasonable cost for this procedure that will last for 10 years, and it allows the responsibility and financial burden to be shared more equally. The way that we can take action in this circumstance is just understanding that methods of birth control need to be more widely suggested to men and women. And the responsibility must fall on both individuals in a sexual relationship and not only fall on the female. Vasectomies need to be more widely encouraged as a short, long-term method. And when two people are always involved in a sexual relationship, and pregnancy prevention is a smart and common thing to do for planning purposes and for safety. It always takes two, and therefore people must consider the fact that they should be just as involved and committed and responsible to taking charge of a birth control plan.